Hi, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the host for the Dean's Chat podcast. For the next few months, we're going to be releasing bonus episodes, and we plan to release those episodes every Friday night. And we're highlighting students from each of the schools and colleges of podiatric medicine. Today, we have 3 students from the Western University of Health Sciences College of Podiatric Medicine. All 3 are members of the American Podiatric Medical Students Association, otherwise known as the APMSA. I would like to introduce each of them individually. First, Ms. Denise Peraza-Martinez from the class of 2024. Welcome, Denise. Ms. Belinda Jimenez from the class of 2025. Welcome, Belinda. And Mr. Brian Wong, also from the class of 2025. Welcome, Brian. One of the goals, of course, is to discuss your educational experience and give prospective students a glimpse of what the Western University of Health Sciences College of Podiatric Medicine is all about. So to get started, Brian, if you wouldn't mind sharing with our audience, what is podiatric medicine?
Yeah, sure. Hi, Dr. Jensen. Thank you for having us. Podiatric medicine is the diagnosis, treatment of diseases and injuries of the foot, ankle, and lower extremity. The DPMs can specialize in specialties such as like sports medicine, they can do surgery, biomechanics, or diabetic foot care, and many others facets.
Well said. And Denise, would you share with our audience the educational pathway to becoming a podiatric physician?
Certainly. And thank you, Dr. Jensen, for your investment of your time in this platform. And thank you for the opportunity to share our stories. The pathway is traditionally a 4-4-3 model. So 4 years of undergraduate school, 4 years of graduate medical education, and lastly, 3 years of residency. There are also options to continue education and training with fellowships. There's also an MCAT that's taken before applying to podiatric medical school. And then throughout, you have the opportunities to shadow, volunteer, and find the niche that you really like to spend your time in.
Very good. And there's an opportunity to do fellowships also. And so more and more students are doing fellowships after the 3-year residency program. Well, to set the stage for the discussion, I would really appreciate if each of you could share your podiatric journey to date. What I was thinking of where you're from, where you went to undergrad, how you found out about podiatric medicine, and how you chose to go to Western for your podiatric medical education. Belinda, would you like to start?
Yeah, I'll go ahead and start. And thank you, Dr. Jensen, for having us on your podcast today. I really appreciate you spending the time with us.
You're welcome.
So I am a very non-traditional student. So I went to undergrad right after high school, but I did not go into podiatric school right away. So I am from Southern California, from the San Gabriel Valley to be exact. I went to Cal State Dominguez Hills for undergrad. And then in undergrad, I had a feeling I wanted to go into pre-med. That was always my idea. I'm going to be in medical school. I'm going to go into pre-med. But things don't always go the way as planned. So after I graduated, I had trouble taking the MCAT. I started working for a few years. And then when the time came to try to apply, I was still struggling with the MCAT, and I was actually advised by one of my advisors to go into a master's program and to get the study skills that I lacked in order to be able to overcome the MCAT. So I actually did a master's in medical sciences at Western University of Health Sciences. And that is actually how I found out more so about podiatry. So when I started my master's program, my mind was still go to medical school, become a doctor. And it wasn't until my master's program that I learned more about it. So at that moment, or at that time, our founding dean for CPM, which is Dr. Lawrence Harkless, he came in and talked to us. And just his energy of how he felt about the profession, all the things he had done, he was talking about it like it was like no big deal. And we were like looking up all of these accomplishments. It was something that started interesting me. So the more I looked into it, the more I realized that I've actually had podiatrists in my lifetime. So not personally, but my grandmother, when I was younger, she was diagnosed with diabetes and she actually had a foot ulcer. She had gone to her regular PCP and he had suggested an amputation. It wasn't until she went to a podiatrist, and that was because of a friend referral, that they were able to salvage her limb. So that was my first real exposure, but I didn't even know it was a specialist. It wasn't until later on. And once I started looking into the profession, I saw that there's a lot that you can do in podiatry. So I started shadowing. I shadowed one of our faculty members at Western. And then once I graduated from my MSMS program, I actually started teaching for a couple of years. So I worked as a college professor at a community college. And it was all because of the darn MCAT. I was just too scared to take the test at this point. And I always tell people that COVID was kind of a blessing in disguise, because once COVID started, that made me actually sit down and study and try to take the MCAT. And I told myself, like, this is the last time taking this test, and I'm going to go ahead and apply to podiatry school. And I felt like all the signs were really pointing me to podiatry, because funny enough, when I was a student, when I was a teacher, I had a student who worked at a podiatry office, and she would tell me about it too. So I'm like, man, there's all these signs coming at me that I should go into podiatry. And yeah, I took the MCAT. I ended up applying to podiatry. I was kind of biased towards Western because of the fact that I had already gone there before. I'm from Southern California. But I still looked into other schools. And at the end of the day, Western was a school that I wanted to go to because I wanted to be close to home. And I was already familiar with the environment there.
Well, fantastic. That's quite a journey. There's a lot of students that do master's programs in preparation for podiatric medical school. And I know that when students come to our school in Arizona, they oftentimes end up at the top of the class. So I do think those master's degrees really do prepare you. So that's a great story. Thank you so much. Denise, can you share your journey in podiatry to date?
Certainly. So I'm Denise Peraza-Martinez. I'm a first-generation Latina. I'm first in my extended family to graduate college and first to pursue medicine. I'm from the general region of Los Angeles, and I went to undergrad here in CSULA. My path to podiatry is also non-traditional. I went to undergrad, had a couple of gap years, and applied, which is not an uncommon thing to have like a couple of gap years in a non-traditional route now. I remember that as early as an 8-year-old child, my parents and my grandmother would have me translate medical information and insurance documents because of their language barrier. I didn't understand the nuances of what I was translating or how to explain it. So there spawned an interest for wanting to understand medicine and help my family navigate that. Through high school and undergrad, I learned more about the social determinants of health, the disparities in access to care, health literacy, and advocacy. And they connected with underrepresented minorities in medicine who are also pursuing medicine. And through their mentorship, I further developed a passion to serve and advocate for marginalized communities. I spent time doing many things to expose me to medicine. I shadowed, volunteered at hospitals, health fairs, worked at federally qualified health centers that largely manage like diabetes, among other comorbidities and illnesses. And that opened my eyes to the need of these vulnerable populations. I hadn't shadowed a podiatrist yet and met the first one when my mother saw one for a biomechanical issue. That spawned a series of events that really influenced everything that led me then to the path of podiatry. So I shadowed podiatric physicians, learned how we contribute to preventative care while having a surgical scope for the foot and ankle as well. And when it was time to apply, Western University really aligned with my values and mission to treat a person holistically and their commitment to serving the community. In the College of Podiatric Medicine specifically, we received a specialized training at Western and also learned medicine alongside osteopathic colleagues. And similar to Belinda, it was after meeting Dr. Harkless and Dr. Satterfield at different prospective student events, they really made an impact with their stories, and their passion and commitment for the profession and students is really what sealed the deal.
Well, that's great. I know Dr. Harkless very well over the years, and I can't even imagine how many students he has led down the path to go into podiatric medicine. He's certainly an icon in our profession. That's great. Brian, would you share your podiatric journey with us?
Yeah, certainly. I think you have a number of non-traditional people here today because similar to Denise and Belinda, my story is also a little non-traditional. I'm from Houston, Texas. I went to undergrad at Baylor University. I was pre-med there. Admittedly, I wasn't the best student. I came out with a decent GPA, but it definitely wasn't competitive enough, I think, for a lot of the schools in Texas. And so I worked as a scribe. I applied to medical school while working as a scribe. Didn't work out. So I actually tried going to the Caribbean for a little bit, and there just wasn't the support I needed there. So that didn't work out. So I came home and I started working as a teacher. I taught AP biology and AP environmental science for about 5 years before applying to podiatric medical school. And I always say that my time teaching was probably the best thing that could have happened to me. I learned just as much, if not more, from my students than they did for me. They taught me how to be a better student. So I definitely attribute a lot of my success now to that time and to them. And I wouldn't have found out about podiatric medicine if not my time as a teacher. While teaching, the school that I was at had a medical science academy. And part of the agendas there was to put on talks for the students. We would get different health professionals just to kind of expose them to different careers in medicine. Just because I know at that time, a lot of students, when they think about medicine, they think, just the MD-DO route or perhaps nursing. And so we wanted to open their eyes to different opportunities that they might have other than those traditional routes. And so that's when I met a podiatrist, which was a parent of one of my students. And as he spoke about the field, and it just piqued my interest. And so I spoke to him a little more afterwards, and I did a little bit more of my own research. And I just really like the idea of being able to help people maintain their sense of mobility. And to me, a person's ability to be mobile is everything to their quality of life. And so and COVID was a blessing in disguise, because that time allowed me to not only balance teaching, but prepare for the MCAT again and submit my applications. And when deciding which schools, my wife had a little bit of say because she would be moving with me. So regionally, she kind of picked the areas that she would be okay with moving to. But ultimately, comparing the programs, and then I think it just comes down to where you feel most at home. And I think when I spoke with Dr. Satterfield, the professors that interviewed me, and then the students that were there, I felt like there was definitely that support system that was lacking when I was at the Caribbean. And so that really sealed the deal. And I haven't looked back since.
That's great. You talk about movement and people being able to continue to ambulate. I think one of the greatest fears the elderly population has is the loss of independence. So that's a very, very common theme you're going to have for the rest of your careers for sure. So you all three have just wonderful stories. I wanted to ask you specifically the impact shadowing had on your decision to go into podiatry. I know you all mentioned you'd shadowed, but do you mind just spending just a minute or so talking about your shadowing experience and how that impacted your decision to go into podiatry? Belinda, do you mind starting?
Yeah, I can go ahead and start with that. So I actually shadowed, like I mentioned, one of our faculty over at UCLA, and she was working at the UCLA Olive View Hospital, which is actually also part of the county. So majority of the patients that were being seen were patients with diabetic bone ulcers, patients who don't speak English, patients who don't have insurance. And when I would, of course, they would use me because of the fact that I'm bilingual. I was just running back and forth and they were just having me everywhere. I really enjoyed that I was able to make that connection with a lot of the patients, because a lot of those patients that I saw were just like my grandmother, diabetic, ended up falling, having some sort of small wound that has now led to something even bigger, and then just trying to get through the system. So that honestly is what sparked it. Another thing that I really liked is that there's also emergencies in podiatry, and people don't realize that. One of the things I always say is when I was shadowing Dr. Wong, she was talking about how earlier that week she was in the OR and she was doing a tendon repair for a 19-year-old. And next thing you know, the 19-year-old is crashing. And so then she goes to the anesthesiologist, and the anesthesiologist was saying that his blood pressure was 60. And she thought, oh, maybe his diastolic was 60. And then she looked and it was his systolic that was actually 60. So he must have had some sort of allergic reaction. And she had to act quick in that moment. And I feel like people don't realize that at the end of the day, you're still a physician. You still have to make those important decisions. And so you still have to have that communication with your anesthesiologist. And sure enough, they were able to get the patient back up. And I feel like you still have that, I wouldn't say excitement, but that moment of like having to make those quick decisions, just like any other physician. And that's something that I also wanted to do. I want to be able to be in that moment and have to like make a decision and hopefully make the right one, which is also why I went into the field, because it's not just always clinic, you still have other things involved with it.
Absolutely. Denise, can you share your shadowing experience?
So I shadowed about 5 different doctors because I wanted to see the differences. And because I was learning about podiatry and I heard about the different sports medicine and wound care, and I thought they were different things in different training, but we get trained in all of that and everyone just specializes differently. So I saw wound care in the hospital, private practice, community health. I appreciated that all the doctors there would make an impact, had continuity of care. They knew their patients, had conversations. It was like everyone was a family. Also saw cases where some doctors delivered difficult news and also help navigate the patient through that vulnerable time, and just noticing the impact that they make in that person's life to make sure that they can get them the care that they need as fast as possible, as efficiently as possible. And with compassion is what I really loved about shadowing. And this is the profession that I realized I wanted to be in through that. And similar to Belinda, then in some locations where I was at, helping people translate if they didn't understand, the English language from the barrier because of the language barrier, then I realized I can make an impact there as well. And it was a beautiful time, and it was a really good time to see a lot of different physicians, how they navigate private practice versus what it was like to be in a hospital.
Very good. I think it's interesting because when we shadow doctors, most of the doctors have tailored their practice to things that they enjoy doing. So podiatrists are typically very happy. And many students come back to me and they say, oh my gosh, I knew podiatry was for me because everybody I shadowed really enjoyed what they were doing. Brian, what was your shadowing experience?
Yeah, very much similar to Denise and Belinda. And then as you just mentioned, the happiness factor, I think everybody that I shadowed was so happy with their career and their decision. They said that it was the best decision they've ever made. And then Belinda kind of touched on this too. The shadowing aspect kind of allowed me to see how much podiatrists are able to do. I think oftentimes there's a misconception that podiatrists are just kind of nail care or orthotics, but there are those emergency cases and there are those clinic cases. So the scope of practice is pretty wide to what you're interested in. And so that kind of made me more excited about the field, is that, I'm not only limited to a certain aspect of care, I'm able to, pursue various interests depending on where my fancies take me as my education continues.
Well said. Well said. Yeah, you really don't know what you like until you get to experience it. And that's what school and residency is all about. So that's great. I want to commend all three of you for being leaders in your school. And it's not easy to handle the curriculum and also be a leader with APMSA. Could each of you just talk for a minute about how you got involved with APMSA and what your individual responsibilities are? Belinda, do you mind going first?
Yeah, I can go first. My experience with APMSA, or how I got involved, is actually through Denise. So Denise is my big. So at Western, we have this big and little system. So for the first years, they actually get paired up with a second year who's been there, and they volunteer their time to go ahead and help them out. So I did not know anything about APMSA, any of the organizations, but podiatry, nothing whatsoever, because again, podiatry is still fairly new. And as much as I tried researching what was going on, I didn't know much about it. So I actually went to Denise and I told her, hey, there's all these different clubs. There's a student government association that I want to be a part of. There's sports medicine clubs. And I'm like, so I want to do something, but I don't know what I want to do. And she was an APMSA delegate for her class. So I asked her, I was like, what is APMSA about? Because they had actually given us a presentation on APMSA. And there's also CPMA, which is the California Podiatric Medical Association. So then I went up to her and I told her, I was like, you know what? I was like, I've always wanted to make a difference, or somewhere, anywhere. And she told me, she's like, well, with APMSA, it's a national organization. She's like, so it's really up to you. Do you want to do something that involves nationally, or do you want to do something that's within the state? That would be something like CPMA. Or you could even just worry and do the Student Government Association. So then I told her, I was like, well, what do you do exactly in APMSA? What is the role? And then she started telling me how they had just opened up a new liaison for DEI that she was a part of, and that you actually get to also be involved in different committees. So you have the education committee, the legislative committee, and how you break up into groups and you work on these different projects. And I was like, that is something that I would totally be interested in. I was like, they have the education committee. I'm like, I love education. I used to teach. And the DEI, I'm like, that is exactly up in my realm. And then she was telling me how we're involved with all these other organizations. We have liaisons for other organizations. So then with us, we had to actually run, and our class had to vote for us. So of course I prepared, I made a speech hoping everybody would vote for me to be our delegate. And I ended up getting the position. So my first year, I didn't really run for anything. It was just as a delegate, only because I wanted to get used to school, get used to the workload. I was taking on leadership positions, but I also didn't want my schoolwork to get behind. Just because I was still getting my feet wet. So it wasn't until my second year that I actually ran for treasurer, and that was just recently this past January. So I ran for treasurer for the Board of Trustees of APMSA just because I realized I can handle a lot more. I, of course, did my research. What would the role of treasurer entail? And of course, is all of our budgeting, attending BOT meetings. And so that my current role right now is the treasurer for APMSA. And then I also have my delegate role, which is relaying all the information that happens during our APMSA House of Delegates meetings to the rest of my class and the school. And my role as treasurer would be, of course, the budget and auditing, attending our board meetings, making board decisions, as I am part of the voting board, so I do get a vote. And yeah, that's how I kind of got involved. It was thanks to Denise, and I really enjoy being there because I feel like I'm able now to connect with other students nationwide. I get to be a part of these big decisions that impact all of our student associations. So that's how I got involved.
That's a great story. But Brian, how'd you get involved with APMSA?
Yeah, very similar to Belinda. I was an upperclassman that kind of pushed me to do it. When I started school, I was a little hesitant. I didn't want to, mess up my academics by pursuing anything that would be too much for me to handle. But when it came time to apply for leadership positions, my upperclassmen kind of pushed me towards SCPMSA, and so I submitted an application. So SCPMSA is the Western's chapter of APMSA. And so I submitted my application to be kind of president-elect of it. And I was fortunate enough to obtain or earn that position. And so, yeah, as part of Western Youth Delegation, I serve as the student body president. Then my role there is to, assist Belinda, Denise, and Josh and the other delegates in representing the Western Youth student body, as well as serving on the president's committee for APMSA. And the president's committee is responsible for putting on the academic athletic conference, which hasn't happened in a number of years because of COVID, but we're trying to bring that back. And then also in selecting the student of the year, which we just recently did. So congratulations to CSPM for taking that one home this year.
Very good. I heard we're getting some different sports involved now. It's been basketball for years. Is there any update on that?
Yeah, it has been basketball for years. The trouble now is trying to find a facility that's able to house that and making it more of a consistent thing. So we're talking perhaps maybe, I don't know if people remember from their school days, the field days, those little competitions that we used to do, like, relay races or little games like that. So we're thinking maybe we can host something like a field day as opposed to a basketball tournament or a volleyball tournament or things like that.
And maybe you could do like suture competitions or speed
Yeah,
casts.
that would be an idea. I'll bring it to the committee.
All right, sounds good. Denise, how did you get involved with APMSA?
So through my passion for wanting to bridge health disparities came the realization that it requires persistent advocacy. When I started looking into career opportunities in podiatric medicine, I also came across information that didn't really highlight podiatry like we know it and love it to be. This was another avenue to support and advocate for a profession that I've committed to. I inquired about the alternate delegate position that was open, but I didn't think myself a good fit because I wasn't savvy about the legislation that surrounds medicine. I just knew that it was important to advocate, but I didn't know all the nuances. Our assistant dean of affairs at the time spent time convincing me about why it was important to represent diverse perspectives, learn and contribute to the growth of the podiatric profession and through APMSA. So I read about APMSA more. I applied and was elected. And alongside Belinda, I also serve on the education committee within APMSA and serve as a liaison for APMSA's Diversity, Equity, and Inclusion Committee. And it's been an honor to learn and serve while in APMSA.
Well, there's no doubt. It's advocacy for the profession is so important, and it's great to see you leading your college. And it must be just a great experience getting to know the students from all the other colleges and schools of podiatric medicine. Well, let's shift gears a little bit. Let's talk about the educational experience at Western U College of Podiatric Medicine. Belinda, would you mind sharing with us the coursework and what the first year is like for students just coming in?
Yes, of course. So when it comes to our first year, we actually have two options. You can either start in the summer or start in the fall with everyone else. And the reason for the summer is there's actually two summer programs that take place. One of them is called Spark, and the other one is ISAC. So for Spark, it is a preparedness program that the school ends up offering to students. It is not mandatory. It's just for those students that maybe they feel they need a refresher when it comes to studying. So they'll go over different subjects they're going to end up seeing throughout the year. So some anatomy, some microbiology, molecular science. And what they do is they kind of do a small crash course to kind of learn how to study for those subjects. So when the year comes, they're a little bit more prepared taking on the first year. And then the other summer program that is being offered is called ISAC. So it stands for Summer Intensive Anatomy Course. That I ended up actually taking myself. So for that program, you have to actually apply. And after applying, they do select a few students. We take all of our classes with the DO students at Western. So same with Isaac, they actually have DO students. Usually about 1 or 2 podiatry students will be in there. And you're pretty much doing what the course says. It's intensive summer anatomy. So intensive part is no joke. You are in there Monday through Friday dissecting the cadavers from head to toe and doing everything that you would have done in 1 year in the matter of 1 summer. Once you complete that, then you no longer have to take the dissection course part of that class during the school year. So it's kind of like getting ahead. And if you end up doing well, they actually select you to be a TA during the year. So during the year, when fall comes around, everyone's going to be doing the dissections. You're still in the dissections in the anatomy lab, but now you're there as a TA guiding everyone else, all of your classmates, how to dissect, what structures to be on the lookout for. And then the anatomy practicals you've already taken. So that is one last exam to worry about. So the way our exams actually work is we'll have our medicine exams all piled up within 1 week, kind of like the finals week, which we refer to as our assessment week. And then during that time on Monday and Tuesday, we have our clinical exam, which is in OSCE. And then we have on Wednesday, usually our practical exam for anatomy. And then Thursday would be our didactic, which is our lecture exam. So if you end up doing ISAC during the summer, then you no longer have to do that Wednesday exam. That's a 1 free day you have to study for your Thursday exam. But again, not everyone has to do it. If you don't want to do it, you don't have to. You can enjoy your summer and just start with everyone else. It does not put you at a disadvantage because everyone else is going to be doing the same thing. It's just that if anything, it would help out during the year just to make the workload a bit less. And that would be for our medicine portion. We also have our podiatry portion, which is referred to as PMP, so Podiatric Medical Principles. And there's 2 main courses is during that first year, and they're spread out throughout the entire year. So for the first half in the fall, you'll have your PMP1, which is going to entail podiatric, lower leg anatomy. We're going to have biomechanics and radiology. And then PMP2 will be more biomechanics, but now actually talking about when biomechanics go wrong. So bunions, hammer toes, and then that sort of pathology, orthotics, proper shoes. And then the second year, we'll have our PMP3 and PMP4, which goes into more detail now into surgery and then into trauma. So for first year, you have to balance your medical classes with the DOs, which are all taking place with them every day. And then you also have your podiatry courses that you end up taking. So the way it works is while the DOs are doing their osteopathic manipulative medicine, we're doing our podiatry classes at the same time. So that's how it works out. And for the first year, you get all of the normals, quote unquote, physiology, anatomy, how the body should work. And then the second year is all of the pathology as to what happens when something goes wrong. So it's kind of good to get that second pass the second year, but now what you'll actually see in clinic.
Oh, that's a very thorough description of the first year. Our school in Arizona is very similar because our students are also taking the basic sciences with the DO students. And then when they do their manipulative medicine, we're doing our podiatric specific courses. So a lot of similarities there. So Brian, what's the second year like at Western U, College of Podiatric Medicine?
So like Belinda said, it's a 2-pass. So your second year, you're making your second pass. You hopefully learned all the normals by then. So now we're starting to talk about the abnormals. In the fall, you have a course called ASOM, Advanced Study of Medicine. This is kind of where we're talking about the microbiology, pharmacology, and then we move into the next block after that, which is where we talk about cardio, pulmonology, and renal, and then we finish off the fall with our another block, which is MSK, derm, and hematology, and then we also have our Podiatric Medicine, which is our PMP3, as Belinda mentioned. And that's the course where we talk about rheumatology, diabetic feet, pes planus, pes cavus, and we look at how we can manage those pathologies conservatively and potentially surgically. And then in the spring, we have another block, which is where we encompass GI, endocrinology, and repro. And then block following that is our psych and neuro. And we also have our PMP4, which Belinda mentioned. And this is where we talk about podopediatrics. We touch on tumors, soft tissue tumors, as well as bone tumors. And again, more practice with the biomechanics and radiology reading, kind of trying to firm up everything before we move on into our clinical years.
Very good. So students always ask me, how does your school support the boards process? Do you have reviews for boards? Do you have specific time off for boards? How does Western U College of Podiatric Medicine handle that?
Sure. In our second year, we actually finished a bit early. We have protected study time for our boards. So we finish our curriculum in May. And then in May of that month, we have almost the entire month is dedicated for your own self-study. We do have a few times a week where we come in and we'll take care of some paperwork for our clinical years coming up in the summer. But the majority of that month is your time to spend reviewing, studying, whatever you need to do. And then when June comes around, we have a more structured study schedule where we have professors coming in and doing review sessions 2 to 3 times a week. And we're actually assigned questions from question banks to kind of get us in that test taking mode in preparation for that July 7th test date that everybody is looking forward to.
Well, nothing's better than getting through boards part 1, right? I mean, that's like total relief. That's fantastic. So once you're through boards and you start your third year, Denise, can you walk us through the third year at Western U?
So third year begins in July, soon after boards part 1. You barely get a weekend to recover. Unfortunately, that's just how the schedule works out with APMLE testing. At Western U, we have 3 different tracks that students can select and apply for. And then those tracks send them to different rotations. In August and September of third year, we spend time applying for clerkships, and clerkships begin in April of our third year. We transition into fourth year while in our clerkships, and in our fourth year is when we begin to apply for residency and prepare to take boards part 2, which for us this time around will be in the last 2 days of November and the 1st of December. So we have 3 days now to choose from for when we want to take boards part 2. And Western U sets aside time for residency interview preparation in December. And in January is where we meet in Frisco, Texas for residency interviews. After that, it's finishing rotations and then graduation.
So how many months of clerkship opportunities do you have?
7.
7. Oh, fantastic. All right. Well, that's great. So if I were to ask each of you, what would be one study tip you would give a new student coming in and just starting the new year? What would that tip be? Belinda?
I always tell everyone is learn how you learn. It might sound weird, but it's like once you know what works for you, that's how you know you'll be able to get through it. Because everyone studies differently. What might have worked for you in undergrad might not work for you in medical school. And also, don't be afraid to change your strategy. If you feel like it's not working for you, go ahead and change it. If you keep stuck with the same strategy over and over, it's not going to end up working out for you. So the biggest thing is learn what works for you. So learn how to learn.
Those are words of wisdom, because once you know how to learn and absorb all that information, it's just rinse and repeat. Just the course changes. Well said. Brian, what would be your tip to a new student?
I would say stay flexible. Like Belinda said, sometimes one method is going to work and other times it won't, and you'll have to change. And for us here at Western, as we said, we go by blocks. And so maybe one block, review cards may have worked, but another block that might not work. So you have to stay flexible and be willing to let go of certain study techniques in opting for another one too, so that you can adjust for the new challenge that's coming. And I think that's also similar to whenever you go out to practice as well. We do have algorithms of how we treat basic pathologies, but sometimes you're going to get curveballs and you have to stay flexible and be able to take bits and pieces from various things that you've learned in the past to kind of help treat that patient.
Well said. Well said. It's a rare student that uses the same techniques in undergrad when they get into medical school. That just doesn't happen. Denise, what's your tip for an incoming student?
I mirror everything Belinda and Brian said. Learn how you learn. adjust, ask for help when you need it. Absolutely ask for help. There's no shame in asking for help. And Western U offers tutoring support and learning skill supports to all of its students. So definitely utilize that to your advantage. And to remember that you're human and not a robot. So adjust and take care of yourself as well.
Well said. A topic I always touch base with on students is giving shout outs to great professors. If I'd give each of you an opportunity to mention a couple of professors and why you like them. And Belinda, if you wouldn't mind starting, that'd be great.
Yes, I would actually want to give a shout out to Dr. Park. So Dr. Joseph Park, he was our instructor for PMP3, and we actually just did a rotation with him, Brian and I, and it was great to actually see those things that we went over in class be applied now in person. Although we did get pimped on that too. And it's like one of those things where like, we know you learned this. And I'm like, yeah, I did. But it was a really good experience, having him both in the classroom and then having him in the field and actually learning from him. And the way he conveys all this information, it was easy to digest and easy to actually understand.
Very good. Brian, professor shout out.
Yeah, Dr. Park, but also Dr. Parks and Dr. Estes. Like as Belinda said, we just finished a rotation with them, and we've had them in the classroom, and just being able to have them now in the clinic, it's amazing because they taught us in the classroom, so they grill us with what we should know and what we should have picked up from their course. But just being able to see them work and put into practice the things that they taught us in the classroom, it was amazing. And also the fact that they're able to teach us while they're caring for their patients was, again, even more amazing to see. So yeah, I would like to shout out them.
Fantastic. Denise, professor shout out.
So Dr. Park and Parks and Estes have already been taken, and they are phenomenal physicians. They're like amazing. I want to give my shout out to Dr. Chandler Hubbard. I appreciate her knowledge, her wisdom, her compassion. She transitioned to running our student-run clinic, the PCC at Western U, and she manages it so well. She treats patients so well. She's so knowledgeable, helps to educate them. So does Dr. Shapiro, Dr. Mulmer, so many of our attendings I would like to give a shout out to, but too many to name, and also to our CPM staff who, keep our college running.
Absolutely. It's got to give credit all around. There's no doubt about that. So there's a lot of stress going through school, right? There's a lot of exams. You're assimilating lots of information. It's one exam after another. What do each of you do to kind of relax and recharge your battery? Brian.
My wife and I just recently welcomed our first child. He's 9 months this month. So coming home to him is awesome. I can have the worst day ever, but just, that innocent smile is amazing to come home to every day. So I love spending time with him. I also like going to the gym, staying active, and cooking as well. So those things keep me grounded.
Wow. Congratulations on the baby.
Thank you.
That is fantastic. Denise.
I am also married, no children, just married, have a husband. It's different for me now because I've been in rotations for some time, but during my preclinical years, what I decided to do was dedicate my Friday evenings off and actually spend time with my husband, since that was really hard to do when I'm studying and then he's working. And we are both nerds who love video games. So we spend our time watching video games and hanging out and nerding out. And then now we still do the same thing in rotations while I'm here in this fourth year of this season. So video games and watching my plants grow and flourish. So just gardening.
Fantastic. And Belinda, what do you do to recharge the battery in between exams?
So for me, it's mostly going to the gym. So I actually go to a CrossFit gym. And there would be times where I wouldn't go because I would get so busy with school. But during those times, I just felt I needed an outlet. And that actually became my outlet. Even during board studying, as much as I tried to just focus on boards, there came a point where all I did was just think about studying. And I always tell people the same example. I even got to the point where I was dreaming about studying. Like someone was asking me in my dream, what is the muscle responsible for ipsilateral rotation? And I woke up like freaking out, like, I don't know what this is. So when I go to the gym, I'm too busy dying from the workout that's my only focus. And that's the only break I get. So that has been my outlet.
Oh, that's great. That's interesting that you're dreaming about it. That doesn't go away. You'll be dreaming about patients down the road, probably. So As a class, Denise, you had mentioned that there's a lot of support services at Western U for tutoring and things. What do you do as a class to have fun together? Do you have activities that you do class-wide?
We did get to, and let me preface it by saying we were the COVID class, so we had to spend a lot of time away, but we tried to find ways to be together. And we tried to do some online sessions where people would join us. We have a representative of our school that's actually in charge of doing some of these activities with our class. So we would host like movie night so we can join in together. And then when it was safer to meet, we would try to coordinate with ice cream or hanging out or having a party after some tests, and just to find time to de-stress and relax and see your friends outside of like a study zone. And now with rotations, we don't really see each other, especially if we're away at clerkship. So some of us will just try to find time to squeeze in some together time there.
Very good. Let's each answer this question. If you were talking to a prospective student that wanted to go into podiatric medicine, what would you tell them about Western U College of Podiatric Medicine? Denise.
Western U is an amazing college. It has so many different things. Their mission definitely aligned with mine, and you'll find something that you align with. You get trained early on, as in our profession, with podiatric medicine, and you also learn medicine along osteopathic colleagues. We definitely highlight treating someone holistically with compassion as a person, and knowing how to treat them well with most advanced medicine. And if you're from the LA area, it's nearby. Everyone here is really nice. We're small and nimble, so we're very mighty, and our college is always supportive, and someone always has an open door available for you when you need help.
That's great. Belinda, what would you say to a prospective student that's contemplating Western U?
I would say go for it. It will get challenging, but honestly, anything that's worth the challenge is worth doing. So definitely go for it. You will have that support system when times get tough. If you're tougher, honestly, you'll get through it. And to always reach out for help. That's one thing I regret not doing in undergrad. And at Western, if you do reach out for help, you're more than likely going to end up getting help from someone, whether it's an upperclassman, the administration, or even the faculty themselves. They are always available. Brian always talks about how he has messaged some of our professors and they'll reply back right away. So they really do care about our success.
Oh, that's great. Brian, what would you tell a prospective student that's considering Western U College of Podiatric Medicine?
Say stop considering and just come join us. But yeah, like Belinda said, we have such a supportive community here. Not only will you be challenged, of course, I think every program that you go to across the country, you'll receive a great education. You'll get what you need to become a podiatric physician. But the community here is just great. Stemming from the upperclassmen to the faculty to the administration. It's just something that you have a support system. And so if you want to succeed here, you definitely will. So yeah, come join us.
That's fantastic. So from my side, answering the questions, I'm sure I'm glad that 3 non-traditional students chose podiatric medicine. I mean, what a credit to our profession going forward. I commend all 3 of you on your leadership roles, and I really look forward to following your careers down the road. So thank you for joining me today on Dean's Chat.
It's been a pleasure. Thank you for having us.
Thank you for having us.
Oh, you're welcome. And we'll be sending you a Dean's Chat cup. Just, you can be drinking coffee. I know you're going to have some long days and nights, and you might need a little caffeine to go with it. So to all of our listeners out there, thank you so much for joining us. If you're on Spotify or Apple Podcasts, please give us a 5-star ranking. If you're watching the video on YouTube, please become a subscriber. And until we see you next week, cheers, everybody.